All of these photographs are from one colony. The beekeeper spotted the infection early, reported it to the bee inspector, and prompt action was taken. There were over 20 other colonies in close proximity. All were inspected and monitored. None were affected. EFB is caused by the bacterium Melissococcus plutoneus. There are typically 300 cases a year, and there are concerns that more cases will present in 2024, because in 2023 our bee inspectors spent a lot of time dealing with Asian hornets, leaving less time for routine inspections, and spring 24 has been long and wet. 90% of EFB cases are identified by the bee inspector on routine inspections. The beekeeper didn't spot it. EFB is notifiable. You must tell the bee inspector if you suspect it in any of your colonies. If you've been keeping bees for a while, it's something you are likely to come across. The first thing to strike you will be the pepper pot brood pattern, sometimes called a scattered or shot pattern. This brood pattern can be seen with AFB, Verosis, poorly mated queens, failing queens, and when there's a strong nectar flow. When there is a strong nectar flow, the girls will unload into the first available cell and get straight back out. The nectar will be moved up to somewhere more sensible when the foraging day is over. On close examination, nectar can be seen glistening in the bottom of the cells, and the queen won't lay in a pool of nectar, so the brood pattern becomes irregular. Shake the bees from the frame so you can examine it closely. The easiest way to remember is the E in EFB stands for early. The disease affects larvae only. They almost always die before the cell is capped. On the few occasions that larvae dies after the capping may be perforated. American Foulbrood, that's AFB, sometimes has perforated cappings, but they are greasy and the larval remains rope when mixed and drawn up with a matchstick or a blade of grass. EFB larval remains do not rope and the cappings are not greasy. Possible sources of infection include infected combs in the brood or super, honey, including robbing and honey left out for the bees to clean up, beekeeping equipment, beekeepers, their suits, hands, gloves, boots and hive tools, infected bees, robbing, drifting and swarming, and moving combs between hives. You must inform the bee inspector. Treatments may be antibiotics or more likely shock swarm or destruction. Larvae are infected after being fed infected brood food by the nurse bees. They typically die aged 4 to 5 days. The bacteria can cause intestinal infection when they grow inside the gut. The infection is yellow and can sometimes be seen through the larval membrane. The bacterium consumes so much food that the larvae starve to death. Look for the infected larvae in these photographs. They have lost their C shape, appear melted, and the brood pattern is irregular. Early on, it might be only 1 or 2 infected larvae on a frame, but it is possible to spot it very early in the infection. Younger larvae die and become transparent. Older larvae become twisted and flaccid. They lose segmentation and turn yellow, then brown. As the larvae decompose, they will eventually form a dark brown rubbery scale that is easily removed. EFB infections can sometimes smell sour, but not always. The smell may be because of secondary infection of the dead larvae. Infection is most likely to be spotted in late spring, when the colony is expanding rapidly and the larvae are being fed sparingly. Larvae fed with large amounts of infected food may go on to develop into healthy adult bees, but the pupation in the cell releases millions of infective bacteria. If nothing is done, the colony will be weakened and die. If the colony has visitors, as in drifting or robbing bees or drones, the disease will spread. Some beekeepers have noticed a behaviour change in the colony before the symptoms can be seen in the larvae. If the temperament of your colony changes, try and work out why. It could be that the weather isn't great, the hive has been kicked by a deer, they are queenless, the beekeeper has been less than considerate, and it's a possible indication of disease. EFB can sometimes be detected in colonies even when there are no larvae exhibiting symptoms. Bacterium can be present without causing symptoms and can be detected on adult bees and in honey, but it isn't everywhere, and this has been shown by testing bees and honey. Not all larvae will be infected. These larvae look healthy, and they are in a colony that is infected with EFB. The bee inspector will select one larvae for testing. It will be pulled from the cell, put into a bottle with a mixing solution, shaken vigorously, and then 2 to 3 drops put on a lateral flow test device. The result takes around 3 minutes to show. 1 line, the control line, is negative, 2 lines is a positive result. After a positive result, a standstill order will be placed on all of the beekeeper's apiaries, not just the one where the EFB is showing. This is because the beekeeper may have transferred the infection. The standstill order will be lifted following an all-clear inspection by the bee inspector after approximately 6 weeks. The bee inspector will keep the bottle used to prepare the lateral flow test. It will be sent away for analysis to confirm the diagnosis and determine which strain of EFB was involved. There are 19 different strains of EFB in the UK. Through tracking strains, the transmission route can be worked out, where it came from and where else it might have moved to, perhaps through the sale of infected bees. There will be no further action until the Ferrer lab has confirmed EFB. If EFB is confirmed, the method of treatment is at the bee inspector's discretion. The beekeeper's preferred action may be taken into consideration. The options are antibiotics, shook swarm, or destruction. Antibiotics are not used very often. If they are, it is usually in the autumn, and the EFB may present again in the colony within a year. Strong, lightly infected colonies may be shook swarmed, and you may be advised to shook swarm all colonies in the apiary. If there is a high level of infection or the colony is not strong, the beekeeper will destroy the colony. For a shook swarm, all of the bees are shaken into a clean brood box with foundation and fed. After the positive EFB result is confirmed by Ferrer, the hive is closed up. It will be useful to place a small sponge under the crown board, under the holes in the crown board. The hive is then left until the bees have stopped flying for the day. The entrance is blocked and the floor sealed. Strong tape and a Varroa floor may be useful, depending on your hive floor. Petrol is poured in through the crown board, and the sponge stops any bees exiting through the hole and holds some of the petrol, which helps with the dispersal. When the petrol goes in, the hive momentarily goes quiet, then there is a roar as they try to escape. In a few moments they will all be dead. Leave the hive overnight. You will need to dig a pit, possibly 1 metre deep and 1 metre square. The bee inspector will advise and carry out the burn. Build a fire in the bottom of the pit and light it. The bee inspector will add all of the comb to the fire, taking care not to drop anything on the ground. The boxes will be scraped out, the scrapings go in the fire. All of the wood equipment will be scorched out. Poly equipment will need to be treated with a 0.5% bleach solution for 20 minutes. This advice may change. Check with the NBU. The bee inspector will scorch out wooden equipment to kill any EFB bacteria on it. Your bee inspector's interpretation of scorching might be heavier-handed than any you have done on your kit before. The bee inspector is right. Follow their example. It's tough. EFB is tough. The bacteria can survive for years, waiting patiently for an opportunity to flourish. It's heat resistant and it's resistant to cold. It will survive being frozen and it is resistant to some disinfectants. At a bare minimum, carry out regular bee disease inspections, at least spring and autumn, and close examination of one frame of brood at every inspection. Refer to National Bee Unit guidelines for higher risk areas. Sanitize all used equipment before use and get into the habit of sterilising your kit before storing it too. Wash your hands and tools in water with soda crystals and detergent between hives. Wash your bee suit at 40 degrees with washing detergent and soda crystals. If there is EFB around, you should wash your boots as well. Buy from disease-free sources. Never buy old combs. Arrange your hives to minimise drifting, with entrances facing different directions, or mark your hives with colours or landmarks. Isolate and don't feed swarms for 3 days, and hive them on foundation. Let them use up any honey they have brought with them to build wax. Any disease should show within 2 brood cycles. The National Bee Unit booklet on Foulbrood diseases of honeybees and other common disorders is available online and updated from time to time. Dr. Kirsty Staden, Senior Scientist with Ferroscience Limited, has several videos on YouTube that are worth watching, with additional input from Bob Loads, beekeeper and former bee inspector, and Garth Matthews, beekeeper.